I want you to take this segment, and I want you to send this to your doctor if your doctor isn't already on the same page. And if your doctor is on the same page, I want you to ask your doctor to tell all their patients. You got to inform yourself, and don't tell them who to vote for. Just say, look, this is dangerous. This is a dangerous situation.
I don't want to become overtly political at this point, but because we're now past the Supreme Court ruling, and many of us were disappointed by that, there is one last court, that is the Court of Public Opinion, and its verdict will be rendered in November, and people do need to be paying attention to what is happening. Well, there's a section in the law, 1311H, that through a credentialing process governed under quality, there may be economic sanctions against a doctor who does not want to take Medicaid or does not want to take Medicare or does not want to work in the exchange. So these are incredibly important issues, and people need to be paying attention. Honestly, you got to repeal Obamacare and replace Obama.
I told you earlier on the broadcast, 83% of doctors are ready to quit because of Obamacare. And doctors are politically different. 83% know that Obamacare is bad, and it will get in the way of you and your doctor, despite what anybody says. We brought in a couple of doctors. In fact, we have, I think, 4 of them, and all of them have considered leaving their practice. But I want to introduce you first to my doctor. He is a guy who I just said on the phone to just the other day. I said, I think he's the most compassionate doctor I have ever met. He not only listens to his patients, but he then prays about his patients. He has spent more time listening to my family and my children and me than I think 5 doctors combined that I've ever had. I wanted to bring him in because he has told me the story that he has had problems in practice before because he does pray with his patients, and he's also been told, you're spending too much time with patients, move it along. That's insane. I always grew up thinking that doctors were rich, but they're not, at least not anymore. He's not rich, he's principled. We have talked about health care before, but not necessarily about care. I want you to meet my doctor, Dr. Grant Beckham. Internal medicine, primary care physician, also Dr. Tracy Hayes. She is an OBGYN. Dr. David Janda, he is orthopedic surgeon. Dr. Michael C. Burgess, he is a Texas congressman and an OBGYN. And we wanted to talk a little bit about this number, and I guess, Dr. Janda, let me start with you. You have been very outspoken saying that this is going to lead to rationing, and you, because of that, are leaving your practice or planning on January 1st, 2014.
That's correct, Glenn. I've been on the front line of healthcare delivery as an orthopedic surgeon for the past 25 years of my career, and I've dedicated myself to providing high-quality care. When you read Obamacare, and let's face it, Glenn, Obamacare is 2 parts. Everybody talks about the health care bill. That's the second part of Obamacare. The first part of Obamacare was hidden in the stimulus bill, and that's where the rationing boards and the enforcement boards were. Glenn, I started talking about this in 2009, and you were the only person in mainstream media that had me come on your show and talk about this.
Because it was clear. It was clear, doctor. It was so clear. And it's called the what is it, the Universal Life Plan, or?
Well, actually, it was called the Federal Coordinating Council for Comparative Effectiveness Research. And Glenn, comparative effectiveness is the rationing formula that was found in Hillary Care that I objected to in the 90s, and it's based on the rationing formula that is utilized in the British healthcare system.
Okay, so you're leaving in 2014 as soon as this starts. How is that going to help anybody? Why would you do that?
Because, Glenn, for 25 years, I've gone in a room and I've been able to face my patients and look at them and say, listen, we're going to do everything possible and provide the highest quality care to make you better. Come January 1st, 2014, that's where the rationing boards and the enforcement board part of this comes in. I would have to go into a room, look at a patient, tell them that I'm taking high quality care of them, when in fact the government is going to be telling me, no, 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 not high quality care, in fact, minimal care. I can't lie to people, Glenn. I took in 1984, when I became a physician from Northwestern University Medical School, I took an oath, as every physician has taken, the Hippocratic Oath. And part of that oath is to do no harm. Glenn, Obamacare is harm because the heart, the soul, the core of it is to ration and deny care. And I cannot be a part of that.
Okay. Grant, you are my doctor, and we've had a conversation before where you haven't even been pushed to the ration part. You've been pushed to, you can't spend so much time with each patient.
Right.
Because of money, but not even Obamacare.
Right.
So what's your problem with Obamacare? Because shouldn't that make things better?
It's bad and evil in so many ways because it's deceitful. First of all, it's a bill that's impossible to read or follow. So just as you were mentioning earlier on the show, who wants to go take a look at it and they trust that it's okay, but it really isn't. But it destroys the doctor-patient relationship. And it takes decision-making away from patients and their doctors and gives it to government bureaucrats. And with the healthcare doctor shortage that you mentioned that we have earlier, it's only going to make time with patients shorter and shorter and shorter. You can't have a doctor-patient relationship, and you're going to have the government telling us what to do.
Okay, you were delivering a baby at 2 o'clock or 4
Yes.
o'clock this morning? 2 o'clock
2
this morning.
o'clock, yes.
Okay. With all the time that doctors spend doing things, how much money do you think you make an hour?
Oh, good Lord. I don't even want to think about that. I'm in complete denial about it,
Yeah.
to be honest with you. I don't think you can go through the day and invest yourself so much in what matters as far as connecting to patients, and the true reward is you know, that sense you get to know a patient, you get to know their families, you get to live through the experiences together, and there's so much of that in what we do, life and death, and I think it's honestly that you feel is the quality that you deliver beyond certainly the technology we offer, but it's that connection, and that's where the reward comes from. And I mean, we're not going to be able to do that.
Have you considered leaving?
I have, in many ways, even scaling back my practice, retiring early, you know, doing a different type of care where maybe I could no longer do obstetrics and no longer do surgery, so that I could have more of a cash pay practice in order to...
They're going to take that away from you.
I know.
They have to.
They will.
They have to.
Remove it.
Because if you guys say, you know what, I'm going to only deal in cash,
Yeah.
then too many doctors are going to leave.
Gonna do
They're
that.
going to, you know, one of the first things that anybody who is into prepping, they will always tell doctors, whatever you do, if there's a big disaster of any kind, that's lasting, do not tell people you're a doctor, because you'll be co-opted. You'll
Yeah.
be forced to stay. And I think that's what happens to you guys. You know, they'll federalize or unionize. They're already talking about unionizing doctors. It'll be a nightmare.
It's frustrating just because you spend, you know, so much time trying to practice medicine, and you know, it's like at the end of the day, there's nothing left. You know, and the barriers are getting greater and greater and greater, and this is more.
Okay, so Congressman, you're a doctor, OBGYN, right?
That's correct.
Okay, and you've been on the front line of fighting this. Every doctor I have talked to since this has started has said, look, there's a problem. We all know there's a problem with health care. It's out of control, blah, blah, blah. It's, you know. But when they get to Obamacare, every single one I've talked to personally, and there's no way I hit all conservatives. I've still a lot of doctors in New York. All of them will say, this is a nightmare. This is a nightmare. Why don't the doctors all rise up? If 83% have considered leaving the profession, why don't they go on strike for a week and say, except for critical care, I'm sorry, we're not doing it, because this is a nightmare, and Americans need to wake up.
Yeah, I suppose we could get to that point, but as I told folks right before the Supreme Court result came out, I really thought the whole thing would be knocked out. But the next day, doctors are still going to be seeing patients. We're driven to do that until the burden becomes overwhelming, as some of your other guests have pointed to. But this 83% figure that you cite, this is not new information, and the trend lines are going in exactly the wrong way. 2009, a group called the Medicus Firm said that 45% of doctors were considering leaving practice. Texas Medical Association, just last March, only 31% of Texas doctors are taking new Medicaid patients because the outlook is so bleak for that underfunded government program. So all of the trend lines are going in the wrong way. You know, when you talked about don't tell people you're a doctor if disaster strikes, I can remember January 1st of 1979, I was a resident at Parkland Hospital. We had one of the worst ice storms the Metroplex has ever seen, and that's exactly right. We were told we could not leave our posts until our replacement was in and ready to go. So many of us, after having worked a 24-hour shift, continued to work well into the next day. Because you're right, we can't leave. We are the court of last appeal. When people get sick or have an emergency or that baby is coming, we have to be the ones on the front line.
Okay, so David, Dr. Janda, let me go to you. You said rationing. What's going to stop the federal government from stopping people like you from leaving? I mean, they've already said that all you guys are thieves and criminals, that you'll cut the feed off of patients. They've already done that. What's going to stop them from saying, you can't leave? We don't have enough doctors.
I guess if you look, Glenn, at what they've already done and how they've gone about it, there's no telling what they're going to do. You know, Glenn, I've been roundly criticized. I wrote an article called The One Word to Define Obamacare. That one word, Glenn, that I used caused a lot of consternation and a lot of heat coming my way. That one word I used was fascist. Authoritarian nationalism that penalizes and punishes anyone and everyone who opposes the state. Glenn, they even state in the stimulus bill that they're going to have a national health care coordinator that's going to, quote, guide medical decisions at the time and place of care, end quote. Mm-hmm. And if you don't go along with their decisions, here's what they say, that penalties will be enforced. And if you continue to go against the system, the Secretary of Health and Human Services can impose more stringent measures of meaningful use over time, end quote. When I talked to members of Congress about this and presented this at the Capitol building in Washington, I asked dozens of members of Congress at this dinner I spoke at, what does that mean? And they looked at me, Glenn, and they said, fines, and you know what, Dr. Janda? If you get out of line, maybe even imprisonment. Glenn, I laughed at that. Nobody else in the room was laughing at when these congressmen said that. I put nothing past the current government as far as the penalties and the harsh penalties they can inflict on any of us, including every American.
Okay, so Grant, what do you do? Because I know you as a man who cares about patients. I mean, I've seen you. I've seen you at 1 o'clock in the morning, up, out of bed, going to help. I've seen you do it. What happens when they say you can't? You can't practice the medicine that you know is right.
I would have to pray for guidance on what to do at that point. I want to care for my patients as long as I can, but if they have control over the decision making and it's hurting patients, and we took an oath not to do no harm and to help patients, then as you've talked about, I will not comply. I would have to take a stand and not comply.
What would you do?
You know, at the end of the day, I'm also a parent. You know, I have to look out for my kids and provide for them and find a way to do that. You know, my husband stays home, and we do that so that we can be good at what we do and be there for our children. So we raise kids with values, and I can't do that at the end of the day when all that changes. So I would probably find something else to do.
Congressman, what does the doctor do? And we have 1 minute. What should the doctor be telling their patients? And what should the patient be doing right now?
Well, I don't want to become overtly political at this point, but because we're now past the Supreme Court ruling and many of us were disappointed by that, there is one last court, that is the court of public opinion. And its verdict will be rendered in November, and people do need to be paying attention to what is happening. Well, there's a section in the law, 1311H, that through a credentialing process governed under quality, there may be economic sanctions against a doctor who does not want to take Medicaid or does not want to take Medicare or does not want to work in the exchange. So these are incredibly important issues, and people need to be paying attention. Honestly, you got to repeal Obamacare and replace Obama.
I want you to take this segment, and I want you to send this to your doctor if your doctor isn't already on the same page. And if your doctor is on the same page, I want you to ask your doctor to tell all their patients. You got to inform yourself, and don't tell them who to vote for. Just say, look, this is dangerous. This is a dangerous situation we're in. Any doubt in your mind this is a dangerous bill?
No, very dangerous, very deceitful.
No doubt.
Okay, good. Thank you, gentlemen. I appreciate it. Back in just a second. Final thought. This is not going to be about politics. This is about principles. We're going to take it upon ourselves to be part of the solution.
We are going to restore history, restore our honor, restore his idea that character is what matters.